It's the vagus nerve, and how vagus nerve dysfunction and disorders are serious contributors of all sorts of neurological challenges in kids today. The science is clear, and there is more research coming out every year linking vagus nerve disorders and dysfunction to all of the common neurological disorders in kiddos, such as autism, ADHD, anxiety, sensory processing disorder, and especially seizures and epilepsy. This video is for parents who are still searching for answers to explain their child's neurological conditions and haven't yet gotten a full understanding of what's really going on from their pediatrician, neurologist, and traditional care providers. It's also for you if you've done all sorts of research into the role of gut health in neurological disorders, and you know about the gut-brain or brain-gut connection and the vagus nerve already, but you want to learn more. In this video, you'll learn all about vagus nerve disorders and how they link to everything from autism, anxiety, sensory challenges, ADHD, to seizures, dysautonomia, POTS, PANDAS, and more. If there was just one thing we wish we could teach all parents, it's this: the connection between birth interventions and trauma and early exposure to toxins in kids and what are called vagus nerve disorders and dysfunction. The vagus nerve is by far and away the single most important nerve in the entire body, serving to control and regulate core developmental and health function in kiddos, such as sleeping, eating, digestion, immune function, speech, communication, socialization, behavior, and emotional regulation. When this one thing goes wrong and the vagus nerve is not working right, it opens the door for a myriad or the perfect storm of neurologic challenges. In particular, vagus nerve disorders and dysfunction are strongly linked to common neurological challenge in kids, such as autism, ADHD, sensory processing, anxiety, seizures, as well as two conditions that are dramatically on the rise in teenagers, especially, which are POTS and PANDAS. So here's how vagus nerve disorders and dysfunction are linked. First, the vagus nerve is often injured or damaged via birth interventions and trauma from things like forceps, vacuum extraction, inductions, and C-sections. Second, the vagus nerve is very sensitive to early exposure to toxins, antibiotics, and overuse of medications. Vagus nerve disorders and dysfunction, known as subluxation, first show up in things like colic, constipation, and ear infections in infants. Parents are mistakenly told, "Don't worry, they'll grow out of it." Then from there, they progress into neurodevelopmental delays and motor challenges, such as missed milestones, delays in walking, delays in talking, frequent tantrums and meltdowns, and other emotional or behavior problems in toddlers and preschool-age children. Finally, from there, with the vagus nerve not working properly to calm, balance, and regulate that side of the nervous system, grade school kiddos and even teenagers end up with a sympathetic nervous system that is stuck in constant overdrive and fight or flight, contributing to challenges with hyperactivity, impulsiveness, paying attention, behavior, anxiety, depression, and more. For many kids, if the vagus nerve disorder and dysfunction is there long enough and severe enough, they even contribute to really challenging conditions such as seizures, epilepsy, POTS, and PANDAS, all of which are conditions that are deeply rooted in neurological dysfunction and very much need advanced neurologically focused care like we provide at Align Family Wellness. Thankfully, the function of the vagus nerve can be measured and assessed in just 3 to 5 minutes in our office with an incredible piece of technology that is truly now on the forefront of all healthcare. It's called the HRV, or the heart rate variability. This exam will tell us in just minutes if your child is struggling with vagus nerve disorders and dysfunction, and if so, how severe it is. Once we have this incredible HRV and our other neurologic exams that look for vagus nerve disorders and dysfunctions, we can then put together a very customized and personalized care plan for your kiddo to address these challenges head on without the use of drugs or surgery.